How does Medicare determine how much a skilled nursing facility gets paid for caring for a patient? The answer is the Patient-Driven Payment Model, or PDPM. In this video, we'll explain how PDPM works, what determines payment, and why accurate assessment is so important. PDPM is the payment model used under the Skilled Nursing Facility Prospective Payment System. Instead of paying based mainly on the amount of therapy provided, PDPM focuses on the patient's clinical characteristics and care needs. The system pays a daily, or per diem, rate during a covered stay. PDPM replaced the previous RUG-4 system in October 2019. RUG-4 was heavily connected to therapy minutes, while PDPM was designed to focus more on the patient's diagnosis, conditions, and care needs. The change also reduced the number of scheduled assessments required. Under PDPM, each patient is classified across 5 case mix components: physical therapy, occupational therapy, speech-language pathology, nursing, and non-therapy ancillary, or NTA. Each component has its own classification and case mix index. These payments are combined with a non-case mix component covering costs such as room and board. PDPM uses a variable per diem system, meaning some payment components change depending on the day of the stay. NTA pays at 3 times the case mix adjusted rate during the first 3 days, then returns to the standard rate. PT and OT pay their full rate for the first 20 days, then gradually decrease. SLP and nursing are not adjusted by day. One of the most important parts of PDPM is the MDS, or Minimum Data Set. This standardized assessment captures information about the patient's diagnoses, cognitive and functional status, and clinical conditions. The MDS information helps determine the classifications for the 5 case mix components. Because MDS information directly affects PDPM classification, accurate and complete coding is critical. Medicare also updates base rates and ICD-10 mappings, making it important for claims processing systems to stay current. Even a small error can affect the resulting payment. PDPM changed the way skilled nursing facilities are reimbursed by putting the focus on patient characteristics and care needs. From the MDS assessment to the 5 case mix components and daily adjustments, every piece plays a role in determining payment. Thanks for watching. For more easy-to-understand healthcare reimbursement guides, don't forget to like, subscribe, and follow for more.